And most people in the United States wind up in assisted living facilities and nursing homes, and they'd rather not. It's a big deal to leave home. And what gets 80% of them in there is loss of hormones. And it's hard to envision that when you're in your mid 40s and you've heard, and I'm leading into your second important question about risk. You've heard maybe there's risks, and maybe I'll go all natural. And then they get in their 70s and 80s and they haven't done hormones. And yeah, we've estimated that 80% of the women who are in assisted living facilities are in there because of lack of hormones.
Do you want to wake up feeling like you're stepping into who you're meant to be, into the best possible version of you? What if I told you that the key to your best life, health, and happiness are all around you? You just have to find what works for you. I'm Hope Pedraza, and I believe that there isn't just one way to live a healthy and meaningful life, and that all you need is a little inspiration to make changes that last from the inside out. Each week, I'll be sharing tangible tips and inspirational interviews to help you on your journey. These are the steps to take to improve your life and live with purpose. This is Hopeful and Wholesome. Hey y'all, welcome back to Hopeful and Wholesome. Today I have on the show Dr. David Rosensweet. Dr. Rosensweet graduated from the University of Michigan Medical School in 1968. He has been in private practice since 1971, but he has now devoted his time and his effort and his energy in all these many years of studying medicine to help women. And this is what we're talking about in this show, y'all. If you have any woman in your life who is premenopausal, perimenopausal, menopausal, postmenopausal, any woman in your life, this show needs to be shared with everyone. I've literally told every woman I know who's menopausal and postmenopausal about this show because he is the founder of the Menopause Method and the Institute of Biomedical Medicine. So he's training medical professionals to master compounded bioidentical hormone replacement therapy. And that's what we're talking about today. He has treated tens of thousands of women with this type of hormone replacement therapy. And it's not what you think. He's going to talk about the risk, the benefits, and exactly what makes this compounded bioidentical hormone replacement therapy different than like the synthetic forms you're getting from your regular doctor, and how this is helping women's longevity, preventing things like dementia and ending up in assisted care living. Like, this goes deep. I'm so excited to share this episode. Let's jump in. All right, y'all, let's jump in. I'm here with Dr. Rosensweet, and we are talking all things hormone replacement therapy. This is Dr. Rosensweet's expertise, and I'm excited for him to share all of his wisdom on this subject. Thank you so much for joining us today.
It's a pleasure to be here.
Yeah. So I would love for you just to give just kind of an introduction, just a background of what you do and kind of where your area of expertise is and why you chose this area of expertise.
Well, I started out in 1968 being very interested in tools beyond medical school. I love medical school. It was like a synagogue to me. But I wanted to get extra information, and I explored nutrition and toxicity and the world of emotions, mind, and life. And then 30 years ago, a patient of mine that I knew really well in her early 40s stormed into my office one morning before hours and said, "Look, I'm going crazy. I'm not kidding you. Don't pretend you know me. I'm going crazy." And I had serendipitously, shall we say, although I don't think it works like that, but speaking to a world expert on progesterone a couple of weeks before, and I gave her some progesterone, and 3 weeks later I got a letter. She said, "I can't believe that stuff. I'm totally myself again."
Wow.
And but I've never really guided my own career. It's unfolded, and before I knew it, I was seeing a lot of women in menopause, and I really enjoyed it. I had the great privilege of dealing with women who cared about their health, and at the same time, I had some real life-stopping events called the failure of the ovaries, and so they were highly motivated, and it was very impressive to see how wonderfully these hormones got them back on the horse, so to speak. And but I wasn't in control. I didn't try and control it, and then I decided to specialize. I thought, boy, to get good at this stuff, there's so much individual variation, and there's so much to learn and discover. So that's what I've done for the last 30 years, is specialize in treating women in menopause and men in andropause with compounded
Yeah.
bioidentical hormones.
Yeah, yeah. Yes, it is. I love this serendipitous story. So all of that just was divinely orchestrated to bring you to where you are now. And I love that. And so, the women who listen to listen to this podcast are really, they're interested in, holistic methods and kind of functional methods and right. But we know, and I know just from the women that I've worked with, like there is a time and place for hormone replacement therapy. And maybe it's not for everybody, maybe it may not benefit everybody, but there is a time and a place for it. Because like you're saying, the example that you gave, like that woman was like, I don't know who I am, what's happening to me. And then her life was totally changed. And I've had clients that I've worked with that have had, similar stories from various types of medications. So I know that sometimes it's necessary. So can you talk a little bit about who is the best candidate for hormone replacement therapy? Like who benefits the most and are there risks involved?
Great questions. Who benefits the most is every single woman and every single man on the planet Earth, because it happens.
Mm-hmm.
Our peak hormone output is at the age of 20, plus or minus 2 years. And these are the most powerful biochemicals in our body.
Right.
And then they decline, men and women. It always happens. And they're so consequential. There are receptor sites everywhere in the body. For women, for example, there's so many estrogen receptor sites in the brain. There's so many women who get cognitive decline, even dementia, that could be alleviated from just replenishing of estrogen. And
Right.
when you bring in the arteries and the bones and the libido and the energy and the vagina and the bladder, and really, because I'm a physician, I see people at all stages of life. I know what's happening at the far end, the 70s, 80s, and 90s.
Right.
And I can tell you, most people who don't do anything about this really wish they could have.
Mm.
And most people in the United States wind up in assisted living facilities and nursing homes, and they'd rather not.
Right.
It's a big deal to leave
Right.
home.
Right.
And what gets 80% of them in there is loss of hormones.
Mm.
And it's hard to envision that when you're in your mid 40s and you've
Yeah.
heard, and I'm leading into your second important question about risk. You've heard maybe there's risks,
Right.
and maybe I'll go all natural.
Mm-hmm.
And then they get in their 70s and 80s and they haven't done hormones.
Right.
And we've estimated that 80% of the women who are in assisted living facilities are in there because of lack of hormones, lost their muscles,
Really?
lost their
Wow.
muscles, sarcopenia,
Yeah.
didn't have testosterone,
Yeah.
and lost their muscles or lost their cognition.
Right.
So many women who have dementia, it could all be prevented. Not all cases of dementia, no way, but a lot of them can be just by replenishing estrogen. So,
Interesting.
and then you mentioned the elephant in the room
Mm-hmm.
that shouldn't be there. But what I'd like to do, because I think it's one of the most important things for people to realize, is really address this subject of risk. And what I know for certain is we're all at risk for thousands of
Sure.
diagnoses.
Yeah.
And a lot of them are very unpleasant.
Mm-hmm.
We're all at risk for cancers,
Right.
hundreds of them. As a male, I have an increased relative risk for prostate cancer, and there's new era reasons for this. This wasn't always the case. And for similar reasons, women are at increased relative risk for breast cancer.
Right.
Wasn't always the case, not when I was in medical school. Yet, given that we're all at risk, here's the science. Women who are treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are not treated with hormones.
Mm-hmm.
And you can even go so far as to say that women who've had breast cancer, they're at an increased relative risk for recurrence than a woman is for ever developing breast cancer alone. But women who've had breast cancer and have that breast cancer properly treated, they're at less risk for recurrence if they're treated with hormones than if they're not. This is the science.
Mm-hmm.
Now, that's not what the public heard.
Right.
This most crazy misogynistic event occurred in 2002, where there was an inappropriate, wrong reporting of a study and it should never have been reported. And anyone who read the original study sees why it shouldn't have been reported, because it was called the Women's Health Initiative. And if you read the study, you see that women who are on Premarin, this is pregnant mare-derived estrogens, actually had a reduced relative risk for getting breast cancer than women who are not treated with Premarin. That was very clear from the study. 21% less risk. The culprit was Prempro, but in the original report, they stated that it was statistically insignificant. Prempro, the combination of Premarin with a progestin. Ooh, I don't like progestins. They had a statistically insignificant increased risk. And I saw that statistically insignificance. And what that means scientifically is you can't draw any conclusions.
Right.
And sure enough, the study committee continued to follow the women. And by 2006, that relative risk had reduced to zero. They knew that.
Wow.
But that wasn't reported out unless you were paying really close attention. Well, I was paying really close attention. I saw it disappear. And then that study committee, the Women's Health Initiative study in 2017, published a retraction. They published it in the same journal. They said that after 18 years of follow-up, there is no increased risk for breast cancer, heart attack, and stroke for women who are treated with hormones.
Wow.
Zillions of people heard about the risk that was falsely reported.
Right.
Hardly anyone, this is women and this is healthcare providers, have heard that it was retracted. Same journal, same study committee. And so I love that you asked this question, because it really injured so many women, got damaged by not taking those hormones.
Yeah. That makes total sense.
And so that's one of the things I love to clarify. We're all at risk, but you're at less risk if you're treated with hormones.
Right. Yeah. And I mean, I think part of it too, like I've had women talk to me about this in kind of the functional medicine world. I think too is a lot of women are scared because of birth control and the things that can happen when you take birth control, but this is not the same thing as taking birth control. It's when your hormones are declining as you age. Like it's a whole different, you're taking it for a different reason, and it's serving a different purpose. So I think there's also some misunderstandings or misconceptions about like what exactly the hormone replacement therapy is doing. So can you speak to that and like why are you taking it? What is the hormone replacement therapy actually doing to your body to help?
Well, I love that distinction. And I actually have very up close and personal experience of this. When I finished my internship, boy, I had gone through 5 grueling years, and I got the best job I had ever had to date. It was working for Planned Parenthood. And then, 95% of the patients I was seeing was young, healthy women who wanted birth control pills.
Right.
And I got a salary. It was fantastic. But I resigned within 2 months because, and this is 1971, because I thought, boy, we're giving young women at the peak of their hormonal output additional hormones.
Right.
And we're giving this artificial thing called progestin.
Yes.
Oh, it's low dose. Yeah, low dose. It's strong enough to stop ovulation.
Exactly.
There is no such thing.
Right.
And so I reluctantly resigned.
Yeah.
Because I thought that was too drastic a thing to do to young women.
Right.
And there are other really excellent methods of birth control. So I became an advocate of that.
Yeah.
And you're so right. And this is entirely different.
Yeah.
Young women, they're at the peak of their output of their ovary of the estrogens, progesterone, testosterone, and DHEA. And by the way, there's more testosterone in a young woman than there is estradiol, their most potent estrogen. Why I'm mentioning that is because it's a very critical hormone to replenish as well.
Right.
It's not a male hormone.
Right.
It's a human hormone, and women need it. And that's the lack of testosterone is what leads most women into assisted living facilities eventually. But it's different when these hormones decline. Well, in the old days, it didn't matter because there was no such thing as menopause, because everyone was dying before they were 50.
They didn't have to experience it.
And there was a few women who squeaked through, but not many. And there was
Yeah.
far fewer men that made it past their 40th year.
Right. Right.
But then through hygiene and nutrition, we're living on. So what are you going to do? You can live through the decline of hormones. People live,
Hmm.
but very few people are walking and talking and thinking by their early 80s or 90s. Yeah, they might. There's because these hormones are so powerful. They
Right.
affect so many different things. So what we do, and this is, let me give you an example. Like young women vary enormously, individual to individual, as to how much estrogen they have. Like you have some young women who have this much estrogen, and they're normal, they're regularly menstruating, they're fertile, they can carry a term pregnancy. Whereas other women need 3 times that much estrogen. There's
Hmm.
individual
Right.
variation.
Hmm.
To be normal, to have normal term pregnancies, and there's everyone in between. Well, our goal in menopause is not to restore youthful levels. We start treating women right here because we know scientifically that this zone is enough to protect the vagina, protect the bones. And then some women do need richer levels, especially when it comes to cognition. So you never say never. But
Hmm.
most of the women we're treating is below this youthful reference range. We know the numbers. I've extrapolated from the medical literature. So we replenish hormones to preserve bones, health,
Hmm.
libido,
Right.
vagina, bladder, everything. When you go down the list, it's everything that matters: sleep, energy, metabolism, weight. And you need them. And, there are some rare exceptions. You see them. My God, she was smoking cigarettes at the age of 120. National Geographic.
Right. Right.
Been smoking for the last 60 years. Yes, these outliers, they do exist, but they are so rare.
Right.
95% of women and men, as they age, they lose muscle, they lose
Hmm.
bone, they lose thinking ability.
Hmm.
Men lose their erection. Talk to a man who's lost an erection, tell him and see how much he's celebrating that, for example. The same thing is happening to women and men.
Right.
So our goal is replenish every single one of these things. Get the right level of estrogen for a woman dialed into her individual situation.
Hmm.
The right level of testosterone. Oh yeah, the right level of progesterone, DHEA, and thyroid is often insufficient in midlife as well.
Right.
So the key to the highway is individualization, not too much and not too little. We know what defines too little.
Hmm.
We know what defines too much.
Hmm.
And that's our goal. And we individualize. And it's
Yeah.
not hard.
Yeah.
And I think Karina has given you a link to a free PDF copy of our book, Happy Healthy Hormones for
Hmm.
Women. I think I've really laid down a roadmap of a lot of what's going on. I wrote it for women. This is
Yeah.
not a professional training. This is for women.
Yeah.
And it's technical. Okay, I agree. But a lot of women that I've dealt with, they got a scientific bent in there, and they like this level of detail.
Right. Yeah. 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 I think I like that you pointed out the like multiple times now. You pointed out the bone loss, the muscle loss, and you mentioned the cognitive health too, because I think that's something that, in fact, I was just having a conversation with my mom and my sister. My sister had to get a hysterectomy pretty young. So she's menopausal now at 40, however old she is, 40, whatever. And so we were talking about that. And I think women or I don't even think it's about forgetting. I don't think a lot of women realize how much estrogen plays a part in our bone health and like holding on to muscle. And, women are like, oh, I can't lose weight or I'm holding on to all this stuff, blah, blah. And I try to have this conversation about muscle mass and it just, they're just, but I think we're not often taught how our bodies work. And I think women, like, we're in this thing we're operating that we really don't know how it operates. And I don't think that we're taught much about that connection between the muscle, the bone, the estrogen, like all of that. So I love that you pointed that piece out because I think that's a crucial piece that it's a really important thing for women to grasp.
Yeah. And it's quite graspable for about 84% of women who experience life-stopping symptoms.
Right.
And although they're drastic, I've always respected those symptoms because they're enough to stop a woman's world and get her to ask what's going on here, and
Yeah.
for her to reach out and get some assistance.
Mm-hmm.
It's the 16% who don't have symptoms at all. And they say, what's the big problem with menopause?
Right.
You have symptoms, but the same loss of bone, the same loss of muscle, the same risk to arterial sclerosis is occurring in these women, the
Mm.
deeper things.
Mm-hmm.
So they're the ones I'm more concerned about. So it's
Yeah.
not some women, it's every woman.
That is, I think that's a crucial piece. And that's an important piece there because you're saying that the women who are like just flying through menopause, no problem, like, oh, this is fine. Like they're still at risk for the same things, regardless of how like quote unquote bad
Exactly.
their journey is with menopause.
Exactly.
Yeah, that's
But they
crazy.
think the other women are off their rocker.
Right. Like, what's so wrong with this? Yeah.
Yeah, what's wrong with them?
Right. Right.
Menopause is easy.
Right. Right. That's a crucial fact right there. So regardless, the same things, because it's the same, like you're saying, it's the same loss of hormones, regardless of how
That's
well or
right.
not well you feel or whatever. So I'd love to get your thoughts on this. And I'm not going to go down the rabbit hole I could go down about birth control because I've done that on multiple episodes. So we won't go down the rabbit hole, but I would love to know. And funny because you're working for Planned Parenthood and working with birth control for a while. Do you find, and just like studies that you've seen or like patients that come into that work with you, do you find that there is any sort of correlation to women's hormones and menopause if they were on birth control for a long period of time? Like, is there any like increase in this symptom or this affects them differently with them being on birth control? I'm just curious.
I don't.
Mm-hmm.
And there are issues that are common. Women who have been on birth control, a certain percentage of them have this phenomena where their body reads, hey, wait a minute, I'm young, I've got enough estrogen, and here I'm getting additional estrogen, and it does a protective measure called raising the sex hormone binding globulin.
Mm-hmm.
And a lot of young women who go on the birth control pill actually have symptoms related to this because
Mm.
the sex hormone binding globulin binds up their testosterone. So there's a certain percentage of women who go on the birth control pill who lose their libido
Right. 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 Right.
because their testosterone's bound up.
Mm-hmm.
So that's an issue with the birth control pill. Does that translate into menopause? Well, we intersect women for the individual they are, no matter what their prior
Right.
circumstances are. And
Right.
same with men. I mean, we
Mm-hmm.
all got a past,
Yeah. Yeah.
and we've all done something that, oh, I wish I hadn't done that.
This is
And
true.
there's workarounds. So although you can tell, I'm not a fan of the birth control, and I'm not a non-fan either. For some socioeconomic groups, it's imperative. It's the only way
Sure.
that they get it.
Sure.
So I don't judge anyone for doing
Right.
that. We're
Totally.
all looking for what's the healthiest thing to do.
Right. Exactly. Exactly. Yes.
And there are some women, every single woman that we do with our method, we do get initial blood tests and we measure that sex hormone binding globulin. And invariably, if so many women who are on the birth control pill, I'll see an elevated sex hormone binding globulin.
Mm.
And for most women, it's not a problem. It doesn't interfere with the menopausal treatment.
Mm-hmm.
Some women, it does.
Mm-hmm.
And there's ways we can address that. So even when I see an elevated sex hormone binding globulin, I'll go, oh, your sex hormone binding globulin is elevated, but we probably won't have any trouble with that.
Yeah. Yeah.
Just proceed. But there's some women we got to pay attention to it. I'm sorry to be so lengthy, and everyone's an individual, and there's so many moving parts
Yeah. No,
that
your answers are informative. I like the lengthy.
that by the time we do a thorough evaluation of women through this very extensive questionnaire, and all of us have got a past.
Right.
All of
Right.
us have got some
For
hurdles to
sure.
deal with.
Yes.
So what?
Right. Right. You can still
Here
help
you
me either
are,
way.
you're 48, and we're going to work with who you are, and we're going to
Mm-hmm.
individualize it to who you are,
Mm-hmm.
and
Mm-hmm.
the good, the bad, and the not so good.
Yeah. Well, I mean, that's the only way to do it. And I think that's the best way to do it. It's the bioindividuality is a real thing. And I think if you're not looking at that, then, I mean, you're not really not helping anybody. Because, like you said, there's a fine line, right? There's a fine line of too much or too little, and you have to find the right spot for the people. So, no, I think that's the only way to do it. And I know there's also multiple delivery methods of this, right? There's different people look at creams and pills and pellets and all different things. Do you have like a preference of what works best, or is it more of like a bio-individual thing, like it depends on the person?
I definitely have a strong opinion and a strong preference.
Okay, let's hear it.
And I must say that whatever a woman has access to, if it's hormones, that's great.
Yeah.
Like even, I mean, women have been treated with hormones, and so have men for 1,000 years. The Chinese figured that if they collected the urine of young women, dried it out, and gave it to the aristocrats, because they were the ones who got it, that these women definitely had a different menopausal era thing. The same with
Yeah.
men.
That's crazy.
And then in the 1940s, the pharmaceutical manufacturers, they started collecting urine from big sources, large animals, pregnant mares. And, the women who got Premarin, pregnant mare urine-derived estrogens, they did so much better than the women who didn't. So whatever you have access to, if it's done reasonably. Now, when I started out, there was already compounded bioidentical hormones, same molecule derived from plants, same estriol, same estradiol, same testosterone that's molecularly identical to what is in a human female or human male.
Right.
So I started right out of the gate with that because it just made more sense to me.
Yes, right.
And 50% of what's in horse urine is human females never seen. So copy nature, it's not rocket surgery.
Yeah, right.
And these compounding pharmacists, they were knowledgeable, so I learned a lot from them. So I became an early fan of compounded bioidentical hormone delivery, and I realized you had to individualize it, and these compounders were capable of dispensing any prescription that I wrote, because that's what their fun was.
Yeah,
how to individualize it.
Right.
And then about 10 years into treating women, the compounding pharmacist who used to ship to all my patients accidentally shipped a biased, the kind of estrogen that I use, to my office instead of my patient. And here I saw this white cosmetic jar full of biased. I'd never seen a hormone. I've been treating for 10 years. And I cracked the seal and opened it up, and out came this strong odor. And what I learned was that these gonadal hormones, male or female, are very poorly soluble. They don't dissolve in water. You needed really strong solvents to get them up into solution so you could deliver the identical dose each time. And I had been a holistic doc my whole career. And I went, and I did the math. I went, this is something. I'm detoxifying most of my patients. And I'm asking them to apply a quart a year of strong solvent. And so we went on to invent, to test, to put through the ringer, organic oils delivery system. So that's what we supply to 35 pharmacies around the country.
Oh, nice.
And we're now looking at worldwide distribution. These are in organic oils, certified organic oils. I'm an organic guy. I always have been. And so these are not solutions. So there's no solvents in there. So you have to shake the bottle before you dispense each dose. So that's my favorite. And, I'm working with people in different parts of the world, and they don't have access to this yet. We're working on this.
Yeah.
So I say compounded bioidenticals are the best.
Yeah.
And you can do individualization with them, for one thing. And then it's topical estrogen. You don't want to take estrogen by mouth.
Yeah.
There's risks involved with birth control pills, estrogen by mouth. Some of those women got clots in their legs or even in their lungs. Rare, but it happened. Oral estrogen, you don't want to do it.
Yeah.
And oral testosterone, you really shouldn't do it at all because it can damage the liver.
Right.
So topical. And so who's doing the topicals the best? The compounding bioidentical pharmacists. And big pharmaceutical manufacturers have tried to mimic this, but they're about 20 years behind.
Yeah.
There's
Hmm.
real limitations there. But if that was all I had, I would
You would do it.
prescribe that. But
Yeah.
I don't.
Yeah.
We've got
Yeah.
these wonderful 7,500 compounding pharmacies in the United States,
Yeah.
30,000 compounding pharmacists.
That's amazing.
They're in
And
every city. They're definitely
yeah.
in Houston, the
Yeah.
home
Yeah.
of the PCCA, the Professional Compounding Planet Earth, and
Yeah.
their past presidents is sitting right there in Houston.
Yeah, that's crazy. Well, and you answered my question because I was going to ask you about the bioidentical and your preference. So you answered my question, but yeah, the compounded version, I've always heard that's the best way to go. So I love that. And so you're saying that what you're giving them is the compounded bioidentical in the oil. So they're putting the
Well, we
oil on.
prescribe everything they need except the hormones. The
Uh-huh.
pharmacists have the hormones. They add it to the organic oil kit
To add
that
it to
we
the oil.
provide.
Okay.
Yeah.
Gotcha. Okay. Okay. I love that. So do you have any, as we start to kind of wrap up here, do you have any for women listening and like they're thinking like, okay, I could be like the perfect candidate for this. What is the best? Do you have any like parting words of like the best way to get started? Or you already said what makes them a good candidate is if they're a man or a woman walking on planet Earth. So do you have any parting words for the people, the women listening that are like, oh, this sounds like something I should really be like, that could really benefit me?
Well, thank you. Yes, the most important question of all, actually. What do I do here?
Right.
And yeah, I do. There's one job I think that every woman and every man has, and it's to seek out a prescriber that's going to be a licensed physician or nurse practitioner. And there are PAs, physician's assistants, who work under the auspices of a provider.
Right.
It's to seek out someone who's really cares about the world of hormones and has chosen to get the additional education because this is not taught in medical schools. It's not taught in residencies.
Mm-hmm.
To get the additional education and really cares about menopause and andropause
Mm-hmm.
and likes to specialize in it. That's the best case. So the job of the individual woman is to go shopping and
Mm-hmm.
find that provider.
Mm-hmm.
Once that happens, once you find someone who knows what they're doing and you like them, you trust them, you're home free.
Yeah.
Because they're going to be able to guide it's easy to do it in a simplistic way and you're going to benefit,
Right.
but that's not what you're going to want.
Yeah.
You are an individual and you're going to want someone who really knows how to find your individual balance. I mean, in women, you're talking about estrogens and testosterone and progesterone, and women vary as to how much they have as a natural amount. You got three variables there. It's very easy. It's routine for a provider who knows how to help you find those dosages. And I describe that in my book. So you want the provider. So how do you find that provider? Well, I go to us first. I've trained physicians and nurse practitioners, and that's the main thing I do.
Mm-hmm.
And we have a website called, is that okay to mention it? Or
Yes, please do. Please.
Brite.live, BRITE.live, LIVE. And you can just put your name in there and someone will contact you about it. Is there anyone in your state that we've trained? And yeah, Texas, we sure have.
Awesome.
I hear Texas is pretty big, is what I heard. The last rumor is out. And indeed, we've trained several providers in Texas.
That's awesome.
If not going through us, I'd say the best thing a woman can do is ask her friends.
Yeah.
If she's got some middle-aged friends, one of them has found
Somebody
their
knows.
way.
Yeah.
Somebody knows. And that's a really great reference because they're going to tell you whether they like their provider or not, whether they trust them, or whether they're getting good results. So a personal reference, there's nothing like it.
Yeah.
Or here's a third way to do it. There are in almost every community, and certainly in big Texas cities, my God, Dallas, Austin, Houston, San Antonio, there are at least 2, 3, 4 compounding pharmacies.
Yep.
And what I recommend to women is actually go find out who's you're closest to and actually go in person. These are busy professionals.
Mhm.
And if you call them up and say, "Hey, tell me your best provider," they're not going to. You're not going to be their highest priority, and they don't know who they're dealing with. But if
Mhm.
you go in and they see you're a human being and you really care, most of them are very kind.
Mhm.
And you can ask them, is there anyone who's prescribing compounded bioidentical hormones to your pharmacy? The answer is yes. There sure are.
Yeah.
Half of the work that they're doing is
Yeah.
occurring
Yeah.
or more.
Hmm.
And who would you recommend for your wife or your best friend? Or because they know who's the most knowledgeable of the prescribers.
Right.
Because they can tell because they've been interacting with them and they've
Mhm.
been interacting with their prescriptions.
Right.
And they can tell when someone knows what they're doing and someone doesn't.
Right. Yeah, for
So
sure.
go in person into your local compounding pharmacy
Yeah.
and
That's
ask to speak to the pharmacist.
hmm Yeah, that's good advice. That's good advice because I've been to, we have a couple that I know of in San Antonio. We have maybe more than two. And I've been before because I've had to use come out of pharmacist for a couple things over the years. And that's such a great point because of course they would know the practitioner that's using them. So of course we'll have the link to your site, the bright.live, because I do have that one to share. So we'll share that. I'll put the link is in the show notes for y'all to go check out. And y'all can see, whatever state you're living in, the doctors that Dr. Rosensweet has trained and are knowledgeable in this because I think it's the best way to do it. Just get somebody who already knows, they've been trained, they know all the things. And like you said, they care and they're doing it in this bioidentical way. So lots of good avenues there. Thank you so much for sharing those. I do have one other question that I want to ask you. I ask all my guests at the end of the show, but do you have anything else you want to share in terms of where people want to, is that the best way for them to find you? Is there any other websites or anything, links you want to share for people to find out more about you and the people you've trained and everything that you're doing?
Well, as far as professionals and women as well, we have a website for training professionals. And you can contact me through that. It's the website is IOBIM.org,
Perfect.
Institute of Bioidentical
Yes.
Medicine.org, IOBIM.org. And if you contact Karina, Karina, at iobim.org and say, hey, you know anybody? Have you trained anybody in my area, my zip code?
Yeah.
She's in charge of all this. And
Nice.
she's a really good person. She'll tell you.
Perfect. Perfect. So we'll put that link in the show notes as well, so y'all can go check all that out. Thank you so much for sharing such good stuff. The last question that I want to ask you, that I ask everybody, it's a deep one. What do you think is the most important thing you can do to live with purpose?
Well, we come to Earth from what I see as the spark of the divine. We have so many wonderful qualities, and we come unfinished.
Hmm.
And we're here to grow. We're here to learn. And I think the primary purpose is one's own personal healing process. So to acquire information and tools to work with your emotions and your mind is the most poignant thing we can do.
Hmm.
Because we all come to Earth with some emotional discomforts and some mental activity that doesn't serve us or humanity.
Mm-hmm.
And so I call this the great work.
Hmm.
And I myself have been committed to this for almost 50 years. Heal thyself. I heard it when they said, physician, heal thyself. I heard that. And I needed it. I looked fine. I was a nice young man. But man, I had a lot and there's so many tools. There's so many teachers. There's so many in your community, men and women who really knew they needed to heal and sought the help.
Mm-hmm.
And there's so many different forms of it. There's social worker, there's psychologists, there's counselors, there's coaches that have done their own work. Those are the
Right.
ones you want.
Mm-hmm.
And there's so many different ways to interact with acquiring emotional skills and consciousness skills. And it's so rewarding
Mm.
because ultimately what's going to happen is you're going to get more present in the moment.
Right.
and you're going to be more able to experience the truth of who we are
Mm.
and the love that we are. And we're going to be able to connect and communicate in ways. And I think individual by individual, if we heal, we're going to really change the collective in the earth.
Yes.
And then some are going to go on to have some wider influences. But start with yourself,
Mm-hmm.
and you're going to affect a lot of people
Mm-hmm.
to the extent that you go. So you know all this hope.
Yes.
So you've been involved in your own process. It's pretty obvious.
Yes. Well, thank you. No, I love your answers. So it's probably one of the most poignant answers I've heard, and I've had over 120 whatever episodes. I'm so like drawn in by your answers. So thank you so much for sharing that and for bringing that depth of wisdom to us. Thank you.
You're welcome.
And thank you for everything you're doing for women and for keeping us out of assisted living homes. I feel like that's a good lesson for us. Like, you're going to save us all. Thank you so much.
Their beloved mother, the day that we could no longer manage her at home, and she was strong, she was willing, but it hurt.
Mm.
It was a big one.
Mm-hmm.
Leaving the home and family, and so
it's hard.
some
it's hard.
foresight and prevention is needed here.
Exactly.
And hormones
totally.
is the most important thing you can do. I promise you, to keep walking and talking and participating and living at home.
Yes. Okay. Key, y'all. He just gave you like the golden ticket here. So take that with you and do with it what you want. But that was the golden ticket. Thank you so much, Dr. Rosensweet. This was so insightful. And obviously I'm sharing on my podcast, but I have a lot of women that I need to listen to this. So thank you so much for sharing all of this with us.
My honor.
Thanks for listening to Hopeful and Wholesome, y'all. If you found value in this week's episode, please subscribe on iTunes or wherever you listen to your podcast and leave a review to let me know what you thought. I'd love to know what you find useful in these episodes so I can know how to provide the most value I can to my listeners. And if you have topics you'd like to know more about, I'd love to hear those as well. So shoot me a message on Instagram, Facebook, or LinkedIn. It's @TheHopePedraza, or you can visit my website, hopefulandwholesome.com. Thanks, y'all.